Adderall is a prescription medication used primarily to treat Attention Deficit Hyperactivity Disorder, ADHD, and narcolepsy. It is a central nervous system (CNS) stimulant that contains a combination of amphetamine salts. Active ingredients. It contains a combination of 4 active ingredients: dextroamphetamine saccharate, amphetamine aspartate monohydrate, dextroamphetamine sulfate, and amphetamine sulfate. These ingredients work together to improve attention span and focus. Total amphetamine base equivalence. The total amphetamine base equivalence in Adderall tablets varies depending on the dosage, ranging from 3.13 to 18.8 milligrams. Clinical pharmacology. Adderall is thought to block the reuptake of norepinephrine and dopamine into the presynaptic neuron and increase the release of these monoamines into the extraneuronal space. This action is believed to be responsible for its therapeutic effects on ADHD. Amphetamines are sympathomimetic agents with stimulant effects greater than other catecholamines. They promote the release of norepinephrine and stimulate alpha and beta adrenergic receptors. They also inhibit monoamine oxidase enzymes and stimulate the central nervous system. Pharmacokinetics. Following oral administration, peak plasma concentrations of Adderall occur approximately 3 hours post-dose. The elimination half-life varies for D-amphetamine and L-amphetamine, with D-amphetamine having a shorter half-life. Metabolism and excretion. Amphetamine is metabolized mainly through hydroxylation and N-dealkylation pathways. The elimination of amphetamine is highly dependent on urinary pH and flow rates. Indications and usage. Adderall is indicated for the treatment of ADHD and narcolepsy. In ADHD, it is part of a total treatment program that may include psychological, educational, and social measures. Contraindications. Adderall is contraindicated in patients with certain medical conditions and in patients taking monoamine oxidase inhibitors or within 14 days of stopping monoamine oxidase inhibitors. Warnings and precautions. Cardiovascular events. There is a risk of sudden death, stroke, and myocardial infarction in adults taking stimulant drugs at usual doses for ADHD. Caution is advised in treating patients with underlying cardiac abnormalities. Administration of stimulants may exacerbate symptoms of behavior disturbance and thought disorder in patients with pre-existing psychotic disorder. Adderall may also trigger mixed or manic episodes in patients with bipolar disorder. Stimulants may cause a temporary slowing in growth rate in children. Stimulants may lower the convulsive threshold in patients with prior history of seizure or EEG abnormalities. Stimulants are associated with peripheral vasculopathy, including Raynaud's phenomenon. There is a risk of serotonin syndrome when amphetamines are used in combination with other drugs that affect the serotonergic neurotransmitter systems. Difficulties with accommodation and blurring of vision have been reported with stimulant treatment. Therapeutic dose. The typical therapeutic dose for ADHD is up to 1.5 milligrams per kilogram per day. Toxic dose. Symptoms of toxicity can occur at doses significantly higher than therapeutic levels, often above 2 milligrams per kilogram. The acute lethal dose of amphetamine in adults has been reported to be 20 to 25 milligrams per kilogram. Toxicology. Overdose or chronic excessive use can cause a sympathomimetic toxidrome, which includes symptoms like tachycardia, hypertension, agitation, and psychosis. Epidemiology. Exposures to amphetamines are common, with severe effects being rare but possible in large overdoses and chronic exposures. Side effects with therapeutic use. Side effects can include tachycardia, hypertension, agitation, dyskinesias, psychosis, and seizures. Chronic abuse can lead to cardiomyopathy, heart failure, malnutrition, weight loss, and permanent psychiatric illness. Poisoning effects. In mild to moderate poisoning, symptoms include hyperactivity, diaphoresis, flushing, mydriasis, nausea, vomiting, abdominal pain. Also, other symptoms such as hypertension, palpitations, tachycardia, chest pain, headache, hyperventilation, and confusion can be seen in mild to moderate Adderall toxicity. Severe poisoning may cause hyperthermia, dehydration, severe hypertension, tachydysrhythmia, myocardial infarction, vasospasm, cerebral vascular accidents, pneumothorax, and sudden cardiac death. Also, delirium, paranoia, psychosis, and seizures are reported in severe Adderall exposure. Other clinical effects of severe Adderall exposure are ischemic colitis, rhabdomyolysis, renal failure, hepatic failure, serotonin syndrome, coma, acidosis, multi-organ failure, and death. Reproductive considerations. Amphetamines can cause neonatal withdrawal symptoms, low birth weights, premature births, and fetal distress. Amphetamines are excreted in human milk, and breastfeeding is not recommended during amphetamine therapy due to the risk of serious adverse effects on the infant. Management of toxicity. Mild to moderate toxicity. Supportive care with monitoring of vital signs, control of agitation with benzodiazepines, and intravenous fluids for dehydration and mild hypotension. Severe toxicity. Aggressive treatment for severe agitation, hyperthermia, and cardiovascular instability. Large doses of benzodiazepines may be needed, and cooling measures should be implemented for hyperthermia. Treat tachycardia with intravenous fluids and sedation. Consider activated charcoal for oral exposures if the patient can drink safely and there is a low risk of seizures. Intubate if necessary to protect the airway, control agitation, or manage hyperthermia and status epilepticus. Hemodialysis and hemoperfusion are not useful due to the large volume of distribution of amphetamines. Overall, the management of Adderall toxicity focuses on supportive care, treatment of specific symptoms, and monitoring for complications. Takeaway: Adderall, a CNS stimulant used to treat ADHD and narcolepsy, contains a combination of amphetamine salts and can cause a range of side effects from mild to severe toxicity, including cardiovascular, neurological, and psychiatric symptoms. Management of toxicity involves supportive care, monitoring, and specific treatments for symptoms like agitation, hyperthermia, and cardiovascular instability. Thanks for watching Medical Toxicology. Take care.